Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and it's so glad to be with you today. I'm really excited. Our guest today is a good friend of mine, a mentor of mine, and someone that I've learned so much from, Dr. Felix Leal. He's the author of this book, 6 Foot Tiger, 3 Foot Cage. Derek, put the slide 2 up so we can see that. This is a fantastic book. I recommend this book to all my patients, every single one of my patients. And I tell them if they just read the first 2 chapters, they're going to know what health and harmony is, or more so what health and harmony is not. Dr. Leal is a brilliant dental medicine practitioner like myself. I'm one following in his footsteps. We practice dental medicine, whole body dental medicine. It's completely different than your typical dentist, which I'm not bashing typical dentists. They're very important, but there are those of us that have seen the connection and how intimate the connection is of the mouth to the entire health of the body. So without further ado, Dr. Leal, I want to welcome you today. It's great to have you with us.
Thank you so much, Hal, for having me. I'm delighted to join you, and I commend you for spreading the words and educating the patient public as well as all the professionals out there. Let me just say a word about dentists. Dentists are trained by dental school to be tooth doctors. And what Hal and I are discovering is that there's a great need for some dentists to become mouth doctors in order to serve the patients whose need is greater than just drill and fill.
Absolutely.
So, Felix, and that's why we created this book and this interview, actually.
Dr. Leal, and you do talk about this in your book, but just briefly give our viewers some insight on how your journey to get to where you are in realizing and recognizing, the importance of the mouth to not only breathing but just total health.
Thank you. Yeah, sure. So I'm very fortunate. I had been a card-carrying American Dental Association member for probably 20 years until I realized that there's more to what we do for patients than just fixing cavities and treating periodontal disease. And I was always interested in the oral contributions to anything. I was an athlete, avid triathlete before triathlon was a household word. I was always amazed by what the human body can do. And I realized, of course, diet has everything to do with sports performance. And as I went on in my exploration, I started wondering about teeth grinding. I mean, why would the body destroy the hardest tissue it has? It didn't make any sense to me, so I took a lot of courses inside and outside dentistry, and nothing made sense. Really nothing. And so it wasn't until I met Dr. Singh, who put the final piece of the puzzle together, that I realized, there it is. I began to look into this, and the book was created out of my conversation with patients, trying to explain to them how Dr. Singh's work can really change their whole body health. So that's how this whole thing.
And just so our audience knows, Dr. Singh is a brilliant orthodontist. He's got several degrees, but he's the inventor of an appliance that will actually help grow jaws in adults, and not just children, but adults as well, and give them more room. Dr. Liao, your book is amazing, and we're talking about the health of the mouth and how the mouth can affect the rest of a patient's health. One of the things inside that mouth is the strongest muscle in the body for its size, the tongue. And if we put up the slide here, Derek, we can see a tongue tie. And we've talked about these in previous podcasts, but this is the name of your book, kind of based on this slide right here, 6-foot tiger, 3-foot cage. Expound a little bit on that.
Sure. So it is really difficult to try to explain to laymen who had never heard about epigenetics. So we'll come back to this later, on which this treatment is based. So before you can treat somebody, you need to explain to the patient what the problem is. So I tried this, I tried that, it didn't work, and so it became a challenge. And one day I said, well, your tongue is too big and your jaw is too small, so it's like having a 6-foot tiger in a 3-foot cage. And I saw the eyebrows went up, and the light bulb goes off in the eyes, and so I know they got it. So that's how the game started. Okay.
A great analogy.
Yeah. So 6-foot tiger refers to that tongue, and when dentists look inside the mouth, they have this narrow tunnel vision that are conditioned by dental school, by dental insurance, by patient expectation to just fix teeth. So the tongue is missing in most dentists' radar. I mean, for most general dentists, and I was a general dentist for 20 plus years, like I said, tongue is a nuisance. It's something you have to elbow out of the way. You end up with cramped wrists and sore elbows, and it's just not a great deal of clinical significance besides you got to get it out of the way to do your dental work. So it turns out, as Hal says, this is a powerful muscle, a versatile muscle. It's actually the shape of your face from the inside out. So when somebody's got a structurally impaired tongue, by definition, they have a structurally impaired mouth. And when you have a structurally impaired mouth, it's sort of like an impaired driver on the road. You can drive, but you're road hazard. Similarly, when you have an impaired mouth structure, you can eat, drink, and talk, but it is a health hazard because there are a lot of things that a structurally impaired mouth cannot do to support your whole body health. So, for example, alignment is one, right? So if you're structurally impaired, most people don't realize this. The jaws makes up 2/3 of your face, ear to ear, and from the corner of your eyes down to your chin. Mm-hmm. So 2/3 of our head is made out of our 2 jaws. And when those structures are impaired, the rest of the body pays a dear price. And one of the dear prices is pain, and the other one is fatigue. And the third one is PMS or erectile dysfunction. Take your pick.
Yeah, there are so many comorbidities. When we say comorbidities, we mean bad things, pathological conditions that result from an impaired mouth, a small mouth. And like Dr. Liao, you're saying, the tongue is the architect of our jaws, and our jaws make up 2/3 of the face. And it really is an epidemic in not only this country, but in civilized world since the since the Industrial Revolution, jaw sizes have progressively gotten smaller and smaller, but our tongues and teeth stay the same size. So we have a lot of people out there with crooked, crowded teeth, and that is not normal, is it?
Yes. So well, I would say the modern Americans are de-evolving at a very rapid rate because of standard American diet, because of the way we produce food, because kids grow up these days eating what for breakfast? Cereal and milk, which is mush, all right? And they have fast food for lunch or dinner, and they're just a mess in terms of jaw development. And we see that every day in our practice, and it's getting worse. And so if we don't have a new class of doctors who can look beyond teeth, then our jaws, our face, our airway are going to be in serious trouble. And this is a route to extinction. That's how important the jaws and the teeth and the mouth is to whole body.
Yeah, if we look at animals in nature, if you look at a dog or a wolf, if it loses even one jaw or all the teeth out of one jaw, it's going to die. And we're slowly. Do what?
I got to tell you the story if I can interject since you brought that up. I was in Philadelphia Zoo in the 1970s, and they were feeding the tigers and slabs of horse meat. And so I had to ask the caretaker, I said, how come this big daddy tiger is getting fed ground meat? And the caretaker said, well, if you look carefully, he broke one of his canines chewing on a cage bar. And after that, he tear the meat off, and we had to feed him ground meat. So out in the wild, you break a tooth, it's death sentence.
Right. Yeah, and the teeth are just part of it. You know, as dentists, we can fix somebody. We can put fake teeth in. You know, and it's not the best thing in the world, but as you know, supposedly the most intelligent beings on earth, we're able to do that. But it's a quality of life. Having impaired mouth syndrome, which you introduce in your next book, it's a quality of life issue. It's being able to overcome so many diseases that people are just used to having. You know, diabetes, high blood pressure. We've gotten so crass to just know that there's a pill for this and a pill for that. It doesn't have to be that way, does it?
Now, how did our ancestors get us here?
Exactly.
Why do we need so much of whatever it is that drugstore has to offer in order to get along?
Our bodies are made to heal itself. Our teeth are made to last over 150 years. But I see people in their 20s and 30s that already worn half of their teeth down. Dr. Liao, you talk, going back to the tongue, the 6-foot tiger, there's, that I always tell my patients, the tongue either works for you or it works against you. It's not neutral. It's not just going to sit there. And unfortunately, most people, it works against them. You've correlated a tongue size with hypothyroidism. If we put up slide 11, we see what's going on here. How does the thyroid and tongue, how do those two things interact? Because I know a lot of people are hypothyroid. They have a reduced thyroid activity.
You bet. So what happens with thyroid is this. You become a doughboy or dough girl. You become puffy, okay? So think of puff pastry. You puff up because your tissues, your skin, your tongue, your internal organs becomes more swollen because it's filled with something called mucin. That's something like, in the word of Dr. Terry Tennant, like Karo syrup. and it just becomes oversized. So if we go back to that picture that you showed about a 6-foot tiger in between two arches, the tongue is swollen, and therefore the two calves are also swollen. And so that's how ladies, when they wear shorts or dress, you can see that the calves lose the shape of the taper. And this is not because they're not born unattractive. That's because of undiagnosed. Yes, that's because of undiagnosed. That's because of the undiagnosed hypothyroidism.
Okay.
So when you have a 8-foot tiger in a 3-foot cage, there's no way you can redevelop jaws enough to accommodate that tongue. You have to know enough as a dental medicine professional to recognize that you need to collaborate with medical professionals to get this under control, because the patient is suffering this thing here, and we're the ones who are going to be the key diagnostician. We are the ones who's going to be wearing the Sherlock Holmes hat. When we look inside a patient's mouth, we'll look at the PSI clues, chairside investigation clues. And so 6-foot tiger is one of them. And the other one in the next slide will show Liao's sign, which is a flat upper lip in profile. When you see the upper lip drop straight down, you can bet that the upper jaw failed to thrive during the developmental years. And when the upper jaw fails to thrive, even if you have a normal sized tongue, you're going to have a choked airway.
I love this. So this is something a parent or a husband or wife looking at their spouse, or a parent looking at their child, they can look at this slide that we're looking at here. So from the base of the nose, if that lip comes straight down, that's a sign that your upper jaw is too small.
Yep. It failed to thrive during the developmental years. And dentists, by the way, are not trained in dental school to read this.
Right.
Okay. Dentists are trained and tested in order to get their license to set denture teeth, to do fillings, to do root canals, but not to do this. So it's not dentist's fault. It's just that, the earth is no longer flat, and we need to move on from teeth to mouth so that we can better serve the patient's total health.
So, Dr. Liao, this is part one of a 3-part series. So, pretty much everything that we're going to be talking about is a result of underdeveloped jaws. And you mentioned epigenetic factors. I think this would be a good time to explain to our viewers, our audience, what is epigenetics, and why are so many people's in modern society, why are so many people have underdeveloped jaws?
Okay, thank you. This is really important. So epi means in addition, okay, or on top of. For example, epidermis, that is the outermost layer on your skin. So your corn, the sole of your feet are thickened, that's epidermis. So epigenetics means what else besides your genes. So we know that if you have twin sisters and you put the skates on one of them and the other one become a couch potato, they'll have completely different figures. This is a example of what epigenetics is. So nutrition is one, mouth breathing is another, tongue tie is another, and the consistency of the food that you eat, whether it's chewy, like for example, when babies are just starting to put things in their mouth, do you give them hard chewy foods or do you give them mush? Right? Do you give babies, newborns, breastfeeding or do you give them bottle feeding? This all are epigenetics. So epigenetics, you can call it nurture, the environmental influences to the genetic unfolding that's built into our double helix DNAs. So
Our DNA calls for, it's programmed to give us full-size jaws that have enough room for all the teeth, correct? And that's everybody, with maybe some very, very rare exceptions.
yes, that includes wisdom teeth. Yes.
Yeah.
Yeah. Yeah. So anytime you have to get your wisdom teeth out, they're impacted because there's not enough room for them to come through. You have underdeveloped jaws. Anytime you have braces taken off, your teeth go back to being bunched up, you have underdeveloped jaws. And if you have underdeveloped jaws, you're going to pay a price in terms of pain, fatigue, moodiness, anxiety, depression, teeth grinding, TMJ, clicks, pops, locks, and pain.
Dr. Liao, one of the buzzwords now that's starting to become more and more common is obstructive sleep apnea. Tell us how the jaw and the tongue all relate to this epidemic that's affecting our entire country.
OSA was not around 100 years ago. Neither is Alzheimer's. All right. So what happened? Because we're into a rapid decline on the one hand, and therefore science has to catch up and say, okay, what's behind this rapid decline? You can see that as a result of a 6-foot tiger in a 3-foot cage. This is a CT image of the tongue in orange. And the tongue, actually, what we see in the mouth is just the surface of a humpback whale. Most of it is below the surface that do not meet the eye. And the tongue is actually a huge organ that goes from the roof of the mouth all the way down to your throat, okay? And so when the jaws are too small, the tongue does not fit between the upper and the lower jaw. Now it has to invade the airway and blocks oxygen delivery. So that is called obstructive sleep apnea. And obstructive sleep apnea basically means that you're not sleeping as a result of trying to rescue yourself from dying in your sleep, from choking. All right. So because you're not rested, because you're deprived of oxygen, you're gonna have cardiovascular problems. So in 1993, William Dement wrote this seminal article in the Journal of American Medical Association. It's called, aptly, "It's Time to Wake Up, America." And he talks about how cardiovascular disease lead a parade of symptoms, okay? And the rest of them are gonna be diabetes, obesity, gastroesophageal acid reflux, lower immunity, you name it. There isn't anything that's not impacted by oxygen deprivation in the whole body. And it starts with the brain and it goes on to the heart. And there's no part of the body that's not affected. So, for example, erectile dysfunction is one. The other one would be root canals. Actually, I did a quick calculation how the root canal diameter, the smallest vessels of a root canal is actually 10 times smaller than the penile vessels. So root canal troubles is actually an even earlier indicator than erectile dysfunction as far as cardiovascular.
That's very interesting, Dr. Liao, because the vast majority of my patients that I treat for impaired mouth syndrome, and we get them breathing better and get their airway fixed and get their airway working, those patients have at least 2 or more root canals, almost all of them.
Yeah. There you go. So root canals is an early indication of impaired mouth syndrome. The question is this: medicine recognizes obstructive sleep apnea at the end of a downhill slide.
Yeah.
I'm really to be a dentist because prevention is built into our professional DNA. So my question is, what on that downhill slide can we pick up earlier? What's on the upper quarter that we could address and maybe reverse course for the patient? And you just did, Hal.
Yeah.
You just kept them from having more root canals and lose more teeth and failed implants and so on.
Exactly. Well, the FAA, just about every rule that's been implemented by the Federal Aviation Control is a result of an airplane crash, and that's kind of how I think medicine and dentistry is. We're very reactive, and now knowing what we know, we can be very proactive. We see here an airway in red with a very narrow arch and a airway in red on the right that's much larger with a big U-shaped arch, not a V. This is the same patient, isn't it, Dr. Leal?
Yeah, it's the same patient because you can see the filling using your forensic dentistry eyes. But because we widen the jaws, with it, the airway gets wider. So if you look at, for example, the columns of your house or the frame of your window, when you move those frames out, it's like widening your arch. Then there is a greater opening for airflow.
And so it used to be that, and many in the orthodontic community still say that once you're past your teen years, your jaws really don't grow anymore. We know now that we can, and Dr. Singh, who we talked to earlier, has invented a device that is able to grow bone in adults. And Dr. Singh, who's a long-term contemporary of Dr. Leal, who's a long-term contemporary of Dr. Singh, has modified that some, and he has his own device. And if we look at slide number 26, we see it's simply a device worn in the upper jaw that can actually stimulate bone growth in adults. So it's very, very exciting. Tell a little bit how that works, Dr. Leal.
Sure. So Dr. Singh defines epigenetics appliance as one that utilizes a patient's own genes. So there's no, genetic mutation. There's no genetic modification. Simply put, we just use these appliances to bring out a better version of you. So if you are in pain and you have a sourpuss face, well, we can bring out the radiant, energetic, reinvigorated version of you. I love my job because all the women come back looking more beautiful, and all the men come back smiling, all right, because they feel better. So if you can go to, for example, slide 29, it will show how the same patient at age 67, after treatment, her lips went from pencil thin, where you have a hard time finding the pink part to put the lipstick on, to having natural, fuller, thicker lips. Okay. And next slide, number 30, also shows how you can redevelop someone to full genetic potential. So you went from a mousy, weak chin girl to someone that you just would appreciate and admire as a thing of beauty. Because this is what full genetic potential looks like.
I always tell my patients the aesthetic part of it is just a wonderful side benefit.
Yes.
Just like if someone has cancer, they start looking really bad. And maybe during the cancer treatment, they're not looking too good. But when they're done, when they defeat the cancer and they're cancer-free and now they can thrive, they look better. Health always looks better than disease. And so the aesthetics are just a great side benefit of this. You get your lips back, you get your cheekbones back, and but the most important part is that you feel better, and now you have an immune system that's going to be able to fight off disease much better than them having an impaired mouth syndrome. And right now with COVID, hopefully we're coming out the other end of it. But talk a little bit about immunity, Dr. Liao, and how that relates to what we've all been dealing with for the past year or more with the COVID virus.
Great point. So health is a series of functions, right? What do we need to stay healthy? We need to eat, digest, eliminate, absorb. We need to exercise. We need to sleep. These are a series of functions that allows the body to make energy from air that we breathe in and food that we take in. So in these functions, we require two things. One, structure. Two, temperature. All right. So if you have poor structure, such as the impaired mouth syndrome, you will have a bunch of symptoms that's associated with oxygen deprivation and body misalignment. But if you also have hypothyroid tongue, you have a lower body temperature, you're going to have poor sleep and you're going to have poor immunity. And in the next segment, we'll talk more about how hypothyroidism and immunity is impacted. But suffice it to say for now that if you don't sleep well, you're going to have poor immunity. If you can sleep well, your natural killer cells is empowered during sleep so that during the day, it is able to take care of any pathogens and viruses that might invade your system. So our body is constantly on guard and defending against, these tiny pathological invaders. And so most of the time we don't see it. We don't feel it because the body takes care of it. This is what innate immunity is. So vaccination is about acquired immunity. Okay, innate immunity is what you come with to deal with whatever down the road you might encounter in your lifetime. All right. So, for example, new variants. So, for example, if it's not coronavirus, it may be another fancy name virus 5, 10, 20 years from now. You just don't ever know. Or you travel to a different country and your immune system is challenged because basically you're out of your typical environment. So the most important thing is that you have to be able to sleep, you have to be able to empower your immune system, and you have to have a mouth structure that can support your sleep. And you have to have a doctor who is well trained enough to recognize the clues of low body temperature in the mouth and around it.
And I love the in your third book, which we'll get to in the third podcast, but you talk about the mouth. The vast majority of diseases that people get they enter our bodies through the mouth, or the mouth is a key factor. Either they're inflammatory diseases from not being able to breathe or sleep well, or they're diseases that come from what we eat and what we put in our mouth. So our mouth is a huge factor in overall health and, as you said, overall immunity in preventing disease from ever occurring. But we have to have a healthy mouth. I would say that if you don't have a healthy mouth, you are not a healthy person, because I work out, I've trained in bodybuilding and run races, and I see these trainers that have amazing physiques, and they come to me as patients and their mouth is full of inflammation. And I set them up and tell them, you're not healthy. You can't be healthy with all this inflammation in your mouth, because if you have inflammation in your mouth, Dr. Liao, that's a pretty good indication that you have inflammation in your entire body. Am I not correct?
Absolutely. This is what we call a holistic mouth. It seems silly that we need to, even use that word. Like, isn't the mouth connected to the rest of the body? I mean, the more common sense people will get it, but the better educated you are, the more specialized you are as a healthcare professional, the more that eludes you.
Absolutely. That is so true. So before we end this first podcast, which our goal for this podcast is to create awareness, what are, just in a nutshell, Dr. Liao, some things that maybe, let's start with children, youngsters. What are some things that parents can be looking for in their child that might indicate they have impaired mouth syndrome or headed that direction?
Okay, so the first thing I would do is make sure that they are not lips apart, that they have a lip seal. Because anytime you're not breathing through your nose, your lips are apart. So if your kid is watching TV or riding in the back of the car going someplace and their lips are apart, you need to talk to Dr. Hal. You need to consult someone who is a mouth doctor who can guide you, because mouth breathing leads to a long and narrow face and therefore high palate and therefore crowded upper arch, like a V-shaped arch form that we saw earlier. Okay, so these kids grow up mouth breathing and they end up with a long, narrow, horsey face and a bunch of crowded teeth. So this is the start of a downhill slide when they grow into adults. The other thing is you watch to see if they're energetic or not. And there is a fine balance between energy to do the work and energy to play. And there's another thing entirely about being hyperactive. That does not count as normal energy, okay? So you watch if is able to enjoy school, learn, engage in play, and maybe even competitive athletics or learn music, but they have difficulty learning. These are all signs that the brain is not getting enough oxygen. If they wet their bed, that's a more serious condition. But the more subtle things are the harder one to detect. And that's why you need a mouth doctor who are well-trained like Dr. Hal here. So for example, someone who's got a stuffy nose, a lot of times the parents don't recognize it, but a trained mouth doctor can. And if they're tired, and if their one eye is higher than the other, if one ear is more flare and the other one is more tucked, if they stand with their head cocked, tilted in one direction or the other, not good.
So parents can look at their child if they're sleeping with their mouth open, if they're watching TV with their mouth open, if they've got crowded, crooked teeth, even a little bit of crowding and crookedness, if their dental arches are not U-shaped, if they're V-shaped.
Or if they're tired all the time.
Yeah. So these are some signs, Mom and Dad, you guys can be looking at for your children. Now, in adults, some of these are the same. Really, they're all really the same. But some of the some of the other factors that can be related to this in adults are very, very serious, right, Dr. Liao?
Yes. So depression, anxiety, waking up, wanting to just not get out of bed. I actually had a website visitor who left me a comment. He says, "What? I thought everybody would spend half a day moping around after they wake up. And it's not normal?" You know, I mean, that's just what's out there.
Yeah.
And you know, if you have to put chapstick on your lips all the time, you're a mouth breather. Okay, if you drink water all the time, you're a mouth breather. Very likely.
Remember when you were a little kid, you know, for those of us growing up in America, on Christmas Eve, You went to bed. As a little child, you didn't have trouble sleeping, but when you woke up in the morning, you hopped out of bed and you ran downstairs and you were ready to get the day going because you knew what was awaiting you. That's the way that we all should wake up every morning, even as adults. Rested, excited, ready to go.
Good night's sleep, yes.
So, Dr. Liao, with this first part of our 3-part podcast, our goal was to educate our viewers on how important the mouth is to health and how detrimental it is to disease, and to recognize some of those factors. And I think you have done a great job of that. So the last thing that I want to do before we end the podcast today is, like we always do here on Health and Harmony Beyond the Teeth, we have our guest pick a song that might apply to what we've been talking about. So, Dr. Liao, what did you pick?
I can see clearly now.
Oh, one of my favorites. Let's play that, Derek.
I can see clearly now, the rain is gone. I can see all obstacles in my way. Gone are the dark clouds that had me blind. It's gonna be a bright sunshiny day.
Oh, I love that song. So, expound, Dr. Liao.
Well, I like to say that with the advent of epigenetics concept, the cone beam CT scanner that allows the dentist to show patients the degree of their airway obstruction and the ability to redevelop jaws regardless of age, even if you're well past your growth spurt years. The earth is no longer flat. We're no longer in the dark ages. And so we can see clearly now how important the mouth is to whole body health. So that's why I picked that song.
Great song for what we talked about today. And hopefully our viewers now can see more clearly about how important the mouth is, not only for their oral dental health, but for their entire body health and well-being and immune system. So, Dr. Liao, thank you so much. I'm really looking forward to part 2, which will be next week. And you have a great day.
Thank you, Dr. Hao.
All right. This has been Health and Harmony Beyond the Teeth with Dr. Hal Stewart and our wonderful guest today, Dr. Felix Liao. Until next time, stay healthy, stay happy, and share your love with somebody. God bless.